Hello, everybody. Welcome to my channel. We are going to be talking today about the risks of hormone replacement therapy. Now, if you have not listened to my previous video titled, Should I Be on Hormone Replacement Therapy? Please watch that and then come back and listen to this, where we're going to be talking about the risks of HRT. I'm Dr. Prabakar. I'm a board certified OBGYN and nationally certified menopause practitioner. And I'm practice in the Bay Area in San Francisco, and really excited to be here to share my knowledge about hormone therapy and just promote a better quality of life for everyone. So let's talk today about the risks. Um, Now, we've all heard of the WHI study, the Women's Health Initiative, that was started in 1991. It was a study that was looking at the effect of hormone therapy in postmenopausal women. And the ages of the women who were enrolled in the study were 50s to almost 79. Okay, so it was a very different population than what we think about today when we talk about hormone therapy, and I'm going to get into that in a little bit. So now maybe you're this type of patient, but I had somebody, and I have many patients like this, but I'm thinking of one specific person who was about 56, and she, reached menopause maybe 4 years ago, doesn't get a period, but, wants to look and feel young and youthful. But she is just so scared of using hormone therapy. She is not able to really enjoy a good intimate relationship with her husband because she has pain with intercourse. So this is a big issue for her. She also feels like she forgets a lot of things. She, is an executive in a pharmaceutical company, and she feels like she's always forgetting things and feels like she's just not on top of her game. And I've been talking to her about hormone therapy for many years. And she's on top of my mind because I just saw her last week, and she's still saying to me, but I'm so afraid of getting cancer. Right. So maybe this resonates with you, or maybe you've heard, this reason before, or maybe you have a friend or a family member who is truly suffering from, menopause symptoms, but is so scared of getting cancer. And this is one of the biggest objections that I face in my office when I try to educate women about hormone therapy, or encourage women, I should say, to start hormone therapy. Where people are very afraid of getting breast cancer, or maybe you have a family member who had breast cancer, a mom, a sister, and so you're thinking, well, my family history is already, I'm already a little bit of a higher risk, and then I really don't want to be on hormones because that's going to shoot up my risk, and I don't want to take that kind of risk. So we're going to look at the numbers a little bit more, but just wanted to set the stage for, what the general public thinks about when they think about the risks of hormone therapy. Breast cancer is probably the first thing that most people are thinking about. And I think, our whole perception of risk was really skewed by the WHI study. Since then, researchers have gone back and reanalyzed that study and published several, studies after that, really dissecting the data and looking at the risks and benefits. And there are many things that came out of that post analysis. And I want to share a few things with you about, risk of hormone therapy. The first thing is that the timing of hormone therapy really matters. Like when you start taking hormone therapy really matters. Now, the average age of menopause is 52. Now, that's the average. So some people reach menopause a little bit earlier, some people reach menopause a little bit later, but the average age, by when you're not getting a period for about a year is around 52. And we know that the sooner you take hormone therapy, after reaching menopause, the lesser your risk is. Okay, so in fact, the guideline is 10 years. So if you reach menopause at 50 and you are thinking about taking hormone therapy, you actually want to do that before 60. So it's kind of a 10-year gap where you can really see Am I getting symptoms? Am I not? What is my overall risk? Do I feel like I would benefit from it? You can think about all of that, and you have about 10 years, which is plenty of time to kind of figure out whether you want to be on hormone therapy. Now, if you're 75 and you reach menopause at 50, well, that's 25 years after menopause. At this point, if you now say, well, I actually want to be on hormone therapy, it's probably a little too late. So this is kind of called the timing hypothesis, where we've talked about the sooner you take hormone therapy closer to reaching menopause, the less risk you have. So one of the things with the WHI study was many of the women they studied were much older. They were in their 70s. And now we're talking about really giving hormone therapy to those who are anywhere from 45 to 55. So overall, at this age group, women are more healthy. They're less likely to be at that age where they're getting strokes or blood clots or cancer or any of those things. And so it's just a much different demographic that we're looking at. And when we think about the benefits of hormone therapy, there are so many. I talked about all of this in my previous video, but just to recap, hormone therapy can help you overall feel better, improve your mood, can prevent bone loss. Especially if you have a family history of osteoporosis or you have osteopenia or low bone mass yourself, can help with hot flashes, sweat, sleep, vaginal dryness, urinary symptoms, painful sex. I mean, the list goes on and on. It can really, really be beneficial and improve your quality of life so much. So many, many, many benefits of hormone therapy. So what are the risks then? Okay. The two risks that I talk about to my patients are risk of blood clots. Okay. So risk of blood clots, which are literally clots that form in your legs that can then travel up to your lung and can sometimes be fatal. Okay. So there are risk factors for having blood clots. So being, a smoker, being overweight, being very sedentary, and then there are specific risk factors like going on a long flight or, maybe you had surgery. There are many specific risk factors for getting clots, but in general, people who are metabolically unhealthy, so type 2 diabetes, cholesterol, high blood pressure, smoking, as I mentioned, all of these predispose you to getting a blood clot. And then when you add estrogen on top of that, it has a very tiny, tiny, tiny increased risk of you getting a blood clot. Knock on wood, in the last 15 years that I've been practicing medicine, I've never seen a patient with a blood clot from hormone therapy, but it can happen, and this is something that I talk to my patients about. And then the second one is a very, very, again, slight increased risk of breast cancer. It's actually almost zero if you talk about transdermal options, which are, through the skin versus taking oral hormone therapy. Now, just to put it into perspective, the risk of getting breast cancer in the United States is 12%. Okay, so 1 in 8 women in the US will be diagnosed with breast cancer. That is extremely high. You add hormone therapy, your risk goes up by 0.0005 in 5 years. So it's essentially a drop of water in a bucket. Okay. So I tell patients, if you were going to get breast cancer, you were going to get it anyway. This is not going to be the thing that drives you to getting breast cancer. So definitely keep up with your mammograms, do your self breast exams, see your gynecologist, get a breast exam every year. These are standard things that I counsel all my patients about. And in fact, I will not write for hormone therapy if you haven't done all of those things and if you're not up to date, on your health maintenance. So you want to be taking care of yourself, but do not let that be the thing that prevents you from taking hormone therapy if you are somebody who really needs it. Okay. And your overall risk for clots, stroke, and cardiovascular disease goes up if you are generally unhealthy. So, again, if you have high blood pressure and high cholesterol and diabetes and all of these things, which also increase as we get older, right? Then this is why we really push for women to start hormone therapy within the first 10 years of reaching menopause, because an 80-year-old is more likely to have all of those diseases that I just mentioned compared to a 55-year-old or a 60-year-old. So the timing is really, really important. So make sure you are discussing this with your gynecologist if you're somebody in perimenopause or you think you may want hormone therapy and you just reached menopause. Make sure you don't miss this window. Okay, it's 10 years within reaching menopause. So these are the risks of getting of taking hormone therapy. But in general, when I think about this conversation, it's not a risk versus no risk, right? Everything we do in life has a risk. I mean, we get into a car and start driving to the store, there's risk right there, right? We put on our seatbelt, we try to drive the speed limit. We are taking precautions, but that does not guarantee that we're not going to get into, an accident. But hey, we need to go to the store to get our groceries or whatever it is that you're doing. So every decision that we make in life has a risk and a benefit. You want to see your family across the country and you get on a plane and you go, right? That's a risk. But you trust that the airlines are doing the right thing, and everyone, you sit on the plane, you're wearing your seatbelt, the pilot is doing everything that they can, right? Everyone is doing all of the things that they can, but that doesn't mean that, bad things are not going to happen. Now, the overall percentage of that happening are extremely low, but there's no guarantee, right? So, like in anything in life, a conversation about hormone therapy is also one that is filled with just a analysis of risk, benefit, and your quality of life. At the end of the day, that's what it often comes down to, because we want to live a long life, but we also want to live well. We don't want to feel bad. We don't want to be grouchy. We don't want to be sleepless. We don't want to be getting into fights with, our spouse. We want to just enjoy a good quality of life. Um, we want to have strong bones, and not have easy fractures. So it all comes down to this nuanced discussion about risk and benefit. It's not about, oh, this is 100% safe and this option has risk. Everything has some degree of risk, and every medication that we take has a certain amount of risk, even Tylenol. Okay, so what I want you to remember is that hormone therapy is really advised to be taken within 10 years of reaching menopause. And number two, that this is a discussion that has to involve the risk, benefits, and your particular quality of life. Okay. So hopefully this has really helped you guys think about, what can hormone therapy help me with? And, what are the risks? And if you have a friend who can use this information, please tag them, send this to them. Again, watch my previous video that talks about, should I even be on hormone replacement therapy? Go watch that. And don't miss my next video. We're going to be talking about what type of hormone therapy is right for me. Okay, there are so many options, so many ways in which you can, use hormone therapy. Well, which one should you choose? Don't miss that. Click on the next video to watch that one. And if you are in the Bay Area, in the San Francisco Bay Area, come see me to have this discussion about hormone therapy. Should you be on it? What are the risks? What's your family history? Where are you trying to go? What is your ideal quality of life? And how can we get there? Let's have this discussion. Appointments in my office are run about 45 minutes to an hour. So this is not your, typical 10 or 15-minute, appointment. We really take the time to get to know you and to have this detailed discussion, because we really believe that everyone deserves a great quality of life. And we are here to help you. All right. So until next time, everybody, again, don't forget to watch my next video. We're going to be talking about what type of hormone therapy is right for you. Okay. Talk to you later. Bye.